My name is Katie Hogarth, and I'm from Volga, which is 8 miles west of Brookings. And I like to walk, and I like to read, and I play the organ, and I like to play with the grandchildren, and we go to the gym. We enjoy that. I've had this knee pain for a year, but it was about the last 6 months that I really couldn't walk. And that's another thing. We like to go to the gym in Volga, and I couldn't do that either. We live a block, not even a block away from church. We had to drive because I couldn't do it. It was on Facebook. This picture came on of Dr. Mayer, and said he was a new orthopedic doctor. And I thought, then I don't have to go to Sioux Falls. So, and then he does robotic-assisted surgery. I thought that sounds good too. And then he did sort of a informational session here in the hospital, and we came to that. And then he showed it all and told us how perfect it can be, how you don't make mistakes with it because they do this CAT scan, and so it's set up for your knee. And I thought it sounded really good. My husband doesn't like to drive in Sioux Falls. If we go to Sioux Falls, he'll drive down there, but in the city, I have to drive because he doesn't like to. And I knew after surgery I would not be able to drive. And so we never did want to go to Sioux Falls for our surgeries and stuff because it's close by, and why drive 58 miles when you're just 8 miles from here? It wasn't even in our mind to not do this. It was really good. The nurses are right there when you need help, and everything is right in your room, and you have your room all by yourself, and plenty of room yet for visitors, and it's such a nice place. My primary doctor said, I don't know why anybody wouldn't want to go to the Brookings Hospital. It's beautiful, and it is. It's so nice and big and airy and clean. Everybody is very friendly. I did physical therapy for 3 times a week at first, and then gradually went down to 2 times a week, and then it ended up with 1 time a week. Oh man, after the surgery, I got up out of bed and I could walk with no pain. It was amazing. Couldn't believe it. People told me it would be that way, but it's hard to believe when you're suffering with pain. And I suffered with it for a long time because I wasn't really ready for surgery. I'd had a lot of surgeries in my life, and I just didn't think I needed another one, but I did. I can do a lot more. I can even cook and bake better than what I could because I couldn't stand very long. So I can do everything now, including mopping the floor, but I don't do it on my knees, but I can mop and I can vacuum and I can do steps. And so it's a lot better. I would. In fact, I did to my brother, and he had his done too. Yeah. And he doesn't live here. He lives 140 miles away. He came, yeah. And his turned out really good too.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.